Welcome to Simply Balanced. My name is David Gensheimer, and in this video, we are talking about knee pain. Some common types of knee pain that you're gonna have are gonna be patellofemoral pain and joint line pain or meniscal pain. So we're gonna teach you how to take care of those problems in this video. We're gonna cover things to avoid, so you shouldn't be doing at all with those types of problems, but as well as things that you need to lengthen and strengthen so that potentially we can keep the pain at bay, but also keep it from coming back in the future. So if you're interested in this topic, make sure you like the video and subscribe. Okay, so common things that you're gonna see with knee pain. The first one is called patellofemoral pain. That is where your patella or your kneecap actually doesn't track right on your knee. So here's a model. If we're looking at this model, you have this little bone floating underneath, and all your quad muscles actually attach into that bone. That bone is called your patella. And what happens is when you bend and straighten your knee, like so, that patella is supposed to be tracking up and downward in a straight line. And what happens is if the lateral portion of our quad, as well as our IT band gets tight, it can actually pull that patella and it tracks to the side or laterally on our knee. And this can cause knee pain. It's actually quite common, especially people who are very quad dominant. They end up having a lot of patellofemoral tracking issues. And what happens is the inside muscles, your medialis, ends up getting a little weak. And so our goal is to get that patella tracking correctly. Now, the most common places that you'll see pain are going to be on the medial side here of the knee. So if this is my knee on my right leg, or let's look at Mr. Bones here. So I'm looking at his knee. On the medial side here of the patella is going to be a common area that you're going to see knee pain. You also may get it below the patella. So if the knee was straight, you may get pain right below the patella. And then lastly, you may even get pain underneath the patella itself. So you may actually even get pain right in the middle of that patella. All three of those can be symptoms of patellofemoral tracking issues. So what we're going to do is we're going to really try to focus on getting that realigned. So when we look at our strengthening exercises, we're going to talk about how to do that, but ultimately we also need to lengthen those areas that are tight. That's the first thing that we need to understand. The second one that you're going to see is also joint line pain. So that's going to be right here at your meniscus. So a lot of times when people are pointing at it and their knees bent, they're going to point right to their joint line on their knees and say that that hurts or is painful. If you're looking at my knee, they're going to point to right here on either side, so either one right here or one right here, and they're going to have some pain in that area. And it could be due to they have a meniscal tear. It could mean that they have some arthritis in there. There could be a lot of things going on, but that's joint line pain. Now, with both of these cases, going to a 90 degrees of knee flexion, so if I looked at Mr. Bones here, 90 degrees of knee flexion here, like so. So that's where the knee is bent to a 90-degree angle. That right there is going to be where their most amount of pain is going to come about. They also call this like the theater symptom. That's where you're sitting in a chair for a long time and then you have to stand up and you get a lot of knee pain. But around 90 degrees of knee flexion, we're going to have a lot of issues. So we're actually going to be avoiding going to 90 degrees of knee flexion, or specifically avoiding anything that causes pain in the joint line or causes pain to the patella in those areas that we talked about. When they bend their knee. So if it's not all the way at 90, but let's say it's close to 90 degrees, but they're having knee pain, whether it's in one of those three spots or in their joint line, then maybe it's still a little bit too much of knee flexion. So we need to keep that in mind whenever we're working with ourselves or with our clients, that we need to make sure that we're not going into that point where it's causing irritation. If it is in the joint line, let's say it is a meniscal issue, you're only going to be causing more irritation and more inflammation, which we do not want to do that. And the same thing's going to happen also with the patella. If it's tracking laterally and you go to that 90-degree angle and they start to have pain, it's going to increase inflammation and cause more issues. So the number one thing we're going to avoid is going to 90 degrees of knee flexion. Now that we've talked about things to avoid, now we're going to introduce Miss Lindsey Burroughs to our channel. I'm super excited to have her on. She's my partner here at Simply Balanced, as well as Mr. Bones. You saw him in a couple of the last videos, and we're excited to have him back on. So now we're going to be talking about stretching. So we've talked about things to avoid, but before we even get into the strengthening aspect, we really should talk about things that we need to lengthen. So the two primary things that I'm going to talk about is something called your vastus lateralis and your TFL, your tensor fasciae latae. Your vastus lateralis, all it is your lateral quad muscle. So if you looked at the quadricep muscles, you're going to see that it's the one on the furthest one to the side. And then we also have our VMO, or vastus medialis, which we'll talk about here in just a second. So on Mr. Bones, it's going to be attaching to his femur and then coming down to his patella right in here. But we're going to look at this on Miss Lindsey here. So she's going to scooch in. Perfect. And what we're looking at is this whole portion of her thigh here. This is called her vastus lateralis. And this guy actually ends up pulling on the patella laterally. When we pull on the patella laterally like that, it causes tracking issues, as well as the TFL. So the TFL is right up here and comes in and attaches into that IT band. Both of those, so the IT band then comes down and has fascial tissue also attaching to the patella, and they can actually cause that patella to track laterally. So those are the two major points that we're looking at when we are trying to lengthen, do stretching exercises. If we can get those lengthened and kind of turned off and really focus in on the other muscles that we're strengthening, we're going to make a huge difference here. In the tracking of the patella, as well as the alignment of the knee with any kind of meniscal injuries that they may have. So this is the first stretch that we're going to be looking at. It's a pretty common one that you're probably used to doing in Pilates. It's basically a lunge, but instead of doing the traditional lunge where we put the foot up against the shoulder pad, we're going to actually take the knee all the way back up against the shoulder pad. Most of the time I like to teach this on a red-yellow. Sometimes it's nice to go a little bit heavier for clients. I tend to not go too light though. When you're ready, you're going to place your knee up against the shoulder pad. And she's going to hop that foot forward. So we're going to find this nice intense lunge. Now if you notice, Lindsey's knee is all the way up against the shoulder pad. A lot of times people who have tight quads, when they get into this, their knee is actually too far forward like so, and they lunge down, and it actually ends up hurting their knee more. They're going to have a lot of knee pain in that position. So when we get there, we want their knee all the way back. Sometimes I'll give them the assist by going underneath the quad, lifting up, and then placing it back down, so that if there is anything pinching or pulling, it's going to kind of take that pressure out of the knee. While you're in this position, you're going to be thinking about pulling that transversus to the spine, or your belly button to your spine, and squeezing your glutes. So we're getting a little bit of reciprocal inhibition here, which in return is going to cause those hip flexors and some of the quads to kind of turn off and relax in this position. Now this is the most common way that we would teach this. One of my favorite ways to do this, especially for people that do have that patellar femoral pain or any kind of meniscal issues, I like to take their hand all the way to the outside and they actually shift their hips over to where they're pressing that hip into the mat here, but they're still keeping that same belly button and glute engagement here. So now we're getting into that TFL that we talked about that needs to be stretched. As well as into the vastus lateralis of the quadricep. So you're going to get a really great stretch here. If they're really flexible, or if they want more of a stretch, they can always reach back with that hand in this position and then pull it in as well. But I find that most people that do have any kind of patellar femoral pain are in no way, shape, or form going to be able to reach back and grab that foot. And actually, they may even struggle just to get into this position in general. So a lot of times what I'll do is start them off in an easier position. So go ahead and come back in. We're going to go down to a red spring just because we are pushing the spring carriage out a little bit more. She's going to put that foot up against the shoulder pad, drop the knee down for our traditional lunge that you're used to seeing, but we're going to do the same steps. Her hand's going to go to the outside of the machine. She'll drive her hips over, belly button and glute engaged, trying to get that stretch in the front of the TFL. So maybe if they're not ready to move where that up to where that knee's right up against the shoulder pad, this is another great way to start them and then work them back towards that. We're going to go ahead and move on, and we're going to look at Thomas test. So this is the second stretch that we're going to be looking at. It's called Thomas stretch, also known as Thomas test. And so what I'm going to do is have Lindsey sit on the front of this bolster here, and she's going to go ahead and lie down all the way onto her back and bring her feet up onto the bar. And actually I'm going to have you scooch back a little bit more. Yep, keep on going right there. So what you want is, you don't want your butt too close to the front. You kind of want your butt right, or your sacrum right in the middle of the bolster. And once she gets there, she's going to drop one leg down towards the ground. Excellent. And so what we're doing is honestly, you can just leave your client here a lot of times and they may get a really great stretch out of this, just being able to let that leg hang. I generally like to do this on the Cadillac or some sort of table that is elevated up so that they're getting that length. Now, the next step that I would generally do if this is starting to not feel too hard is we can take actually weights and we can strap the weights onto their ankles and also place them on top of their thigh. And I have about, let's see, 10, 15-ish, 16-ish pounds over there, and I can put that on also their ankles and their thigh, and that will start to also give that stretch sensation as well. And then lastly, if we want to go a little bit more intense here, we can actually press in on their leg. Now, if it's hurting their knee by me pressing, you can do this with the leg straight, like so, and press downward, and I'll have her actually pull her ribs down just a little bit to counter that. If it doesn't bother their knee, you can let that knee bend and you can drive it down as well. And so first we're kind of looking for that rectus femoris muscle to start getting a stretch. And then over time, we can also take it across the body this direction. So now we're going back to that TFL once again, as well as that vastus lateralis. So they may start to feel it up here, and they even actually may feel it start to wrap into the iliac crest as well, because that means that we're getting into that psoas as well as the iliacus. And then lastly, you can always go into an inner thigh stretch this direction, and now we're going to get more. But generally speaking, for people that are struggling with any kind of knee pain, this one going across the body as well as the one right down the middle are going to feel the best. Just be careful with how much you push. We're not trying to tear the muscles or anything else. We're just getting it to where they get a nice stretch. Some people are going to need a little bit more than others depending on how tight they are. Once they finish this stretch, I generally like to stay here at least 1.5 minutes to upwards of 3 minutes because we really want this to relax and turn off. But because of that, those muscles are in a really elongated state. The muscle spindles aren't firing anymore, or they're not going to tell the muscle to contract anymore. So we need to be very careful when we lift this leg up. So what I'll do is I'll wrap my arm underneath their thigh, and I'll tell them not to lift their leg, and I'm going to lift it, and I'm going to make sure that they keep those hip flexors off, and I'm going to bring that foot all the way back up and place it on the bar for them so that they're not gripping and kind of getting rid of all the good work that we just did. And then she'll drop down that other leg, and we'll do the same thing. Yeah, if you want to go ahead and get that good stretch, you can. Awesome, let's move on. Just like we were talking about before, one of the big things is after we've talked about avoiding, we've talked about stretching, and now we're going to go into strengthening. The big areas that we need to be strengthening are going to be that glute medius, the glute minimus, the external rotators, so your go-go queens, as well as a little bit of that glute max. So if you're looking at Mr. Bones here, this is the iliac crest right here. That's where the glute medius and minimus are attaching, and they actually come down and attach to the greater trochanter. And then a lot of your external rotators are going to be attaching all into the sacrum as well as into the pelvis here and coming out to that greater trochanter as well. And then lastly, some of the lower fibers of the glute max are going to be going into the shaft as well as into the greater trochanter. And those are all going to be the huge part of muscles that we want to strengthen to help with better knee alignment. If we were thinking about where do we want to feel it on our glutes, we're going to be really wanting to feel the top part of our glutes here. That's where the glute medius and minimus is. When we talked about avoiding earlier, that TFL in the front, that's where a lot of times where we're going to get activation. So whenever we're doing this glute work or any of these exercises, we really don't want to be feeling it anywhere in that TFL. We want to keep it in the glute medius and minimus. We also want to try to get into that glute max as well, but predominantly this is where we want that sensation to be focused. Awesome, thanks Lindsey. So the first exercise that we are going to be looking at is side lying leg series. So a lot of people that practice mat Pilates are going to be very familiar with these types of movements, but we're going to change it up just a little bit. So I'm going to have Lindsey go ahead and lie on her side, and she's going to bend her bottom leg just to create a little bit more stability. And what I'm going to have her do is I'm actually going to have her keep her heel attached to the wall as she does this movement. And then I'm going to have her put her hand on her hip, pull her ribs back, and she's going to find that nice stable neutral position. So she's not going to be too arched. A lot of times we get too arched in our lower back, and in return it causes us to turn our glutes off. So if anything, you want to be thinking about tucking underneath while you're in this position. Now the reason why we're attaching the heel to the wall is it's actually taking our hip into slight extension here, which will encourage more glute medius and minimus instead of the TFL, because when our leg is in front of us, that TFL tends to work a lot more than the actual glute medius and minimus. So by taking that leg behind us, it kind of helps turn the TFL off a little bit. It's still going to be firing, but a lot less than general. So the first thing she's going to do is she's just going to be dragging her heel up the wall, and she's going to be lowering it back down. And the whole time she's keeping her ribs and abdominals lifted off of the mat as she does this, and she's going to keep doing that movement. You can also do this turned out. Yes, exactly, without the hip rocking backwards, keeping that hip forward. And it's a little awkward turned out, but we're still getting into that glute medium in, but now we're adding in all of those external rotators. So the go-go queens, your gemellus superior and inferior, your obturator internus and externus, and then your quadratus femoris. Now, once you finish that, the next level would be to actually add weight. So one thing that you could do is you could actually use ankle weights, like so. This is what I'm going to have her use. But you can also, let's strap that on there. You can also use a TheraBand of some sort. The problem with the TheraBand is that you are going to have to probably straighten out this bottom leg just a little bit more when you use it. And you'll have it wrapped around both ankles as you do this movement. Same thing, everything's nice and stable, and she's going to lift that leg up, keeping it parallel at first. Yep, and then go back down. Excellent. And then you can also, once again, do it turned out as well. Perfect, awesome. Generally speaking, rep ranges here, I like higher rep ranges when we're first getting used to this and they're starting to learn to engage that muscle. I feel like it's going to be a little bit easier to get bring awareness to that muscle. As they get stronger and the patellar femoral pain decreases, or they have no knee pain at all, then we can start adding heavier loads in and being actually able to do a little bit more quick twitch muscle fibers instead of our slow twitch muscle fibers. Let's move on to exercise number 2. So, the next exercise that we're going to be looking at is very similar to our side leg series, but instead of doing a traditional side leg series exercise, we're going to be doing it actually in a modified plank position. Sorry, Lindsay. So what she's going to do is pull this bottom leg back underneath her, and she's going to get into a straight line from her knee all the way to her elbow. Excellent. So when she lifts up, just go ahead and lift up there and hold it. And what I want you to do is tuck your tailbone once again, and we want this straight line right here at the front of the hip. So you can even tuck even more. Yes, excellent. So there should be a straight line at the front part of this hip, and then the hips are also nice and stacked. We're going to take that leg slightly behind us again, but this time you don't need a wall, and she's going to lift and lower that leg just like she did in the last exercise, but this time she's having to maintain that stable neutral, get that abduction. Now the beauty of this one is now not only is the top leg working, but also the bottom leg is working. So we're getting that glute medius and minimus on the bottom leg. And actually there's been a lot of research showing that actually side planks are one of the best ways to get in that abductions work. You can also then, when you want, add that ankle weight as she does the side plank as well. And you can also do it turned out if you want to. Go ahead and relax. That's awesome, Lindsay. So that's exercise number 2. Okay, moving on to exercise number 3. This is going to be some standing toe taps as well as airplane will be kind of the progression of it. So let's go ahead and look at that. She's going to turn onto her side. What she's going to do is she's just going to lift one foot off the ground. It doesn't matter which foot you want to start with. She's going to find her awesome, amazing neutral position. Not bad. Pull those ribs in just a little bit more. And now what she's going to do is she's going to reach down to touch the ground with her toes, and she can bend her knee as much as she needs to touch the ground. Now she has stupid long hamstrings because she was a dancer, and so ideally I would have her bend her knee a little bit more if she was an average person because they wouldn't be able to maintain that neutral position the whole entire time. Now what we want to avoid is that they go down, then moving into a flexed position with their spine. This is no-go here. We want to keep everything nice and stable and maintaining the neutral. The reason why we want to do that is that we're eccentrically loading those glutes. So by doing this, those glutes are elongating as you go down and you're bending your knee. Now, once again, it's not a huge bend in the knee, but it's enough to get down to the ground and back up. And it's going to vary a little bit depending on from client to client. Go ahead and relax for a second. So we're really trying to get into that glute stabilizers. Once again, the glute medius and minimus will help keep our hips square, but now we're also including the hamstrings and the glute max. So it's basically kind of like a single leg Romanian deadlift. So single leg Romanian deadlift is kind of the concept. Now we're going to move on to airplane. This is going to be the next step or progression if that's a little too easy for you or your client. So she's now going to come into where she's parallel to the ground with her leg and her torso. Yes, excellent. Once again, we're going to square those hips off to the ground, and she's going to be maintaining that neutral position. And you can do whatever you want with your arms. Some people like to lower their arms down and lift them up. What she's going to do is bend her knee and then straighten it. Bend her knee and straighten it, and ideally maintaining a beautiful neutral the whole entire time. Now, because they do have patellar femoral pain, you're only going to bend the knee as much as they can without pain. That's the key. If they start to have pain in that knee, it's probably a little bit too much here. Go ahead and relax. That was perfect. So that's airplane. With both of these exercises, once again, we're going to try to stick with a little bit higher volume their first time around. And then as they start to get stronger, then we can start adding in more load. But in general, this is kind of where I want to rock and roll with our glute strengthening. So 10 to 15 reps is kind of what we're looking for on each side. Let's move on to our last exercise. Now this is our fourth and final exercise. This is standing splits on the reformer. Now if you don't have a reformer at home, you may be able to do this with a band and you can do some side steps or something like that. But I love this exercise because it really gets into that glute medius and minimus. Now one quick thing here, if you are not in a neutral position, meaning you're too anterior with your butt here, that TFL will take over every time, every day of the week. So you really have to fight to get them to keep that pubic bone pushing forward. If anything, I would rather them almost fight for a posterior tilt when they're first getting into this, and then as they get stronger, be able to maintain a neutral position. So Lindsey's just gonna put her arms next to her sides. We're gonna do normal standing. She's not gonna bend her knees or anything else. She's gonna lengthen out of that lower back. And if I put a triangle on her pelvis, it should be, that triangle should be pointing straight to the ground here. And then from here, she's gonna gently push the carriage out and then bring the carriage back in. And as she does this, one of my favorite things to do is actually look at her from the side and see if when they press out, that pelvis tilts. A lot of times when people press out, as they go, they'll start to tilt that pelvis. So we really want to be aware of that and actually start to do a little bit tuck, tuck, tuck. Yes, even more. Yes, that's perfect. So that would be parallel. We can also do this turned out. Once again, I love doing turned out work because it can, once again, get into those external rotators. But generally when they turn out, they want to arch more. So we're going to really fight to tuck, 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 keep the ribs pulling back. Now, if you also notice, last thing, go ahead and relax for a second. Notice that Lindsey's palms were facing forward and her heart was open. I also really love that for the upper body placement. I know this isn't related to the knee, but a lot of times people will put their hands on their hips and they end up rolling their shoulders forward. So ideally, we don't want to do that. So if anything, I like that palms forward, so we're getting that lateral rotation of the humeral joint, similar to when we talked about a couple videos back with the shoulder health, how we want those the greater tubercle avoiding the acromion. So just getting in a good habit of good posture. So that's our fourth and final exercise. Thank you guys for watching. We really do appreciate it. I hope that this was educational for you. If you have any questions, please put them in the comments below so that we can try to answer them and get back with you and maybe even make a future video about the topic. Once again, like the video and subscribe, and we look forward to seeing you in that next one.